There's no study that has ever been done showing that if you got the full vaccine schedule, that you have an all-cause mortality benefit over people who basically avoided vaccination. If the vaccines worked, these guys would have done that study 20 or 30 or 40 years ago. But where's your study? For California to say, you have to have these shots to go to school, it's unethical. They don't have the safety data on any of these shots to establish that the safety level is below the risk of dying from the vaccine preventable disease, not for any single disease.
Hey folks, welcome to the Alix Mayer Show. Today, I'm going to be talking to Steve Kirsch. He's a brainiac and the most lovable brainiac you've ever met. He's a Substack sensation. He's the inventor of the optical mouse. He even had something to do with inventing email for ARPA way back when he was 12 years old. You're not going to want to miss this episode. He brings us through all the COVID data, all the death data after COVID shots, and he is going to blow your mind. So welcome to the show. The Alix Mayer Show is sponsored by Mish International, gold and silver specialists since 1963. When you need protection from monetary inflation and leveraged assets exposure, you contact the dedicated people at Mish International. Mish International, a family business, offers true expertise, integrity, reliability, and fair pricing of gold and silver. Visit their website at mishinternational.com. That's MISH international.com. Steve Kirsch, it's such an honor to have you in my studio today for the Alix Mayer Show. Thank you so much for coming.
Thank you, Alex, for inviting me to be one of your first guests.
It's my honor and pleasure. And you are an impressive guy. And your impressiveness started long before COVID and the COVID era. In fact, on Wikipedia, it sounds like you were very impressive at the age of 12. So I want to go back there and talk about UCLA and ARPANET and what you did when you were 12.
Well, I was interested in computers in school. And so I lived not that far away from UCLA. And UCLA was the network measurement center on the ARPANET. So they were ARPANET node number one. And so I built up a relationship with the people that worked there, and they allowed me to use the computers there when they weren't using them, which meant I would have to use them after 5 o'clock and on weekends. And I ended up writing the email program on their computer that allowed them to talk to each other.
Did they ask you to do that, or did you just think that would be a good project?
I thought it would be a good project because they didn't have one, and it was needed. And so I wrote it, and I think I actually wrote it in assembly language. So it was pretty tough.
That's incredible. That pretty much defines your whole life of you seeing a need for something and then just jumping in and doing it, right?
Yeah. No, necessity is the mother of invention, as they say.
That is so true. So where did you go after that? Did UCLA hire you for anything?
I was a little bit too young for them to employ me. So it was just a good learning experience. I got to know people like Vint Cerf and John Postel. And Vint actually was the one who recommended that I apply to MIT for school. And so I did that, got in, and enjoyed that.
Okay. What'd you do at MIT?
I was in electrical engineering and computer science, and I figured that by the time I got there, I knew a lot about computer science. So I tried to get into the electrical engineering side of things to really understand electrical engineering from a hardware point of view. And so I did that, and also met up with the people at MIT doing in the AI building, and met some various people that are well known to people, like the inventor of Emacs, for example.
Who's that?
Richard Stallman.
Okay.
Or RMS, as he was known, or is probably still known.
Wow, AI back then, we're talking about the 70s?
Richard Greenblatt. They had it was called the AI Lab, and they created a list machines there, and these were $100,000 computers, and they had mechanical mice on them, which were always breaking, and so that led to me saying, again, necessity is the mother of invention. You couldn't use a $100,000 computer because the $100 mouse was broken. And so I ended up inventing an optical mouse that would read a pad in order to go and track motion.
Okay, and that's what you're most well known for now. And you invented that when you were, what, 16, 18?
Probably, yeah, around 16 years old or so.
Because when did you go to MIT? When you were 14?
Let's see. This is 1974. I was born in 56, so that would be 18.
18. Wow, that's really impressive. Okay, so fast forward, you've started a lot of Silicon Valley companies that have been very successful. And then what happened in 2020?
Well, there was something called, wasn't there like a COVID virus that was going around?
I heard that.
Yeah. And so that was a little bit disturbing because I was running a business and we were basically told to go stay home. And of course, staying home is the wrong thing to do in a situation like this, because what you want to do is everybody should be encouraged to go to the beach, go to playgrounds, all the things that they closed. That's where people should have been, because the virus only gets spread if it's concentrated. And if it's dispersed very quickly after someone breathes out and you're in a room where it's open air, there's a draft, whatever, you're in an airplane, then it gets mixed. And when it gets mixed, it gets diluted so quickly that nobody else can catch the virus from you because it's so dilute at that point. And so it's all about mixing the air, mixing your viral particles with all of the air so that it becomes too dilute before it reaches you. And so we were told to do, precisely the opposite of what we should have been told to do. And also that everybody was banking on these vaccines as being, this is how we're going to get out of it. It was first it was, hey, let's do lockdowns, 15 days to stop the spread. And then it evolved, of course, into the, hey, we're going to have a vaccine, we're going to get this on the market quickly. And everyone is going to look the other way when there are any safety problems, because we have to get these vaccines out because they're going to save lives, and they're going to, more importantly, they're going to end the pandemic so that we can get rid of the lockdowns and all this that we should not have imposed in the first place.
So you have a good BS meter. When did your BS meter start to go off?
Unfortunately, too late for me. It went off after I had 2 shots of Moderna. And then I was contacted by one of my followers on Twitter, and she asked me, is the vaccine safe? And I assured her, of course it's safe. It's the safest thing ever. They've done all these tests, and they assure us all that nothing has been tested more thoroughly than these vaccines. And you should get your shots as soon as possible. And I said, why do you ask? And she said, well, 3 of my relatives got the shot, and they're dead a week later, and they were perfectly healthy before the shot. And so I did the mental calculation, because I knew a safe vaccine kills fewer than 1 person per million. So this person who had 3 deaths, that is 1 in 10 to the 18th, which is a very small number. That person can't exist.
Yes, statistically impossible.
If it was statistically impossible, couldn't have been the shots. Either that or they were lying to us. But,
right.
Why would the government lie to us? And so I told her this. I said, well, that's impossible. It could not have been the vaccine. We don't know what it was, but it couldn't have been the vaccine.
You sound like the establishment right now.
I know.
ABV, right?
Yes,
anything but the vaccine.
I was there. It was anything but the vaccine. It couldn't have been the vaccine. It's statistically impossible. And so when I told her that, she said, yeah, but they're dead. And, there's not much you can say in response to that. But it got me thinking. And then a week later, my carpet cleaner comes to our door to clean our carpets, and he's wearing a mask, and I'm giving him a hard time. And I said, hey, don't you know that if you wear a mask, if you have 2 vaccines, you don't have to wear a mask? So I am buying everything.
And you're parroting Fauci.
I'm parroting. I'm like Fauci Jr. I'm like Fauci disciple.
Hard to imagine today.
It's hard to imagine. And so I told him that, and I said, why didn't you? And he said, well, I only got one shot. I said, why didn't you get the second shot? He said, well, I had a heart attack 2 minutes after the first shot.
And this guy's in his 30s or 40s?
Yeah, he's in his 30s. That was pretty stunning. Okay. To me, that was like a week before I heard this story of death, and now I'm hearing a story of near death from someone who shows up at my door, where I just get into a casual conversation about, why are you wearing a mask? Mm-hmm. And so after that, that was the tipping point for me. That was like, okay, wait a second. The first one I could write off, maybe some weird stuff is going on. But you can't have see 2 black swans in a week and not be suspicious. Right? If you're a critical thinker, if you still have any critical thinking skills left. And so I took that and I started looking at the data. I looked at the VAERS data in particular, and that was shocking. But everything I read and everything I learned, and I had multiple sources of evidence, showed that these vaccines were a disaster.
Okay, wait, let me sit on something for a second with you.
Yeah.
So the first place you turned was to VAERS. How did you find out about VAERS?
I'm not sure, but I was just doing. I wanted to do research on vaccine safety. So pretty soon you're just reading everything you can lay your hands on.
Okay, and you probably found it because it's our only death tracking database for vaccines, right?
It's the safety monitoring. It's the official safety monitoring for the U.S. government.
Right.
That's where the safety monitoring is. I mean, how could you not find that?
Right.
Very quickly when you first start researching the safety of vaccines. That is the repository for safety events.
It is. So what first raised your eyebrow once you started looking in the data, something that confirmed what you'd been seeing?
Well, it was a pattern that the number of VAERS reports is like this. And then the COVID vaccines come out and it goes like this. And was not long after that there were more death reports for the COVID vaccine than all the death reports for all vaccines in the history of the whole tracking program combined.
Right, like 39,000 deaths now after COVID shots reported.
Yeah, it was
reported.
Some large number like that. Yeah, mm-hmm. And you have to realize that that's worldwide reporting, and if you just limited it to the United States, it's less than that. It's only 20,000 or so, only about half that number. Still, this is a step function from any other vaccine ever, and it's not like other shots like the flu shots aren't given to the majority of people in the United States. Like 60% of the people get flu shots. And so it's not like, the reason there are so many deaths is because the COVID shots were given to so many more people. No, they not more than double like what the people who get the flu shot would be. And the death numbers are nowhere. They're minuscule for
right.
for the flu shot.
Because I think 60% of people get the flu shot still.
Yeah.
So it's similar to uptake of COVID shots.
Yeah,
so,
they shouldn't. The flu shots are completely useless, but for mortality and they actually there are some studies that show that they make you more likely to get the flu. So why would you take them? Will you take them? The reason I took them is because my doctor said, if you take the flu shot, you're going to be less likely to die from the flu. But of course, I learned later that all of that is based on somebody told him that rather than the data actually shows that, because very few people are going to take the time to look at the primary data and analyze it. They're all going to get their information from their colleagues or from the American Academy of Pediatrics or all of these so-called authorities, and that's how it spreads. It spreads from misinformation spreader to other people who then spread that misinformation. And so the top misinformation spreaders, of course, are the CDC and other entities in the United States government.
I thought it was you.
Yeah, well, if you look on Google and you type in misinformation super spreader, I rotate between being the top hit or the second to top hit.
Okay, I'm sorry, you're not always the top one.
Yeah, believe me, I tried.
Okay, so you're in the VAERS data, you're noticing data that confirms your observations, and then you probably start telling people in your life, your family, your friends, and they probably didn't have as positive of a reaction as you thought they would. So tell me about that.
Dr. Byram Bridle did some research. He did a Freedom of Information Act request on the Japanese government, and he got the Pfizer data. And the Pfizer data showed that there was a biodistribution study, and it showed that when you inject the vaccine into your arm, it doesn't stay in your arm like normal vaccines. It just goes everywhere in your body in places that it should never go. And then it causes those organs to produce spike protein because of the instructions. And so all across your body, your body basically lights up. And what happens is that your immune system then attacks all these organs. And if you have a very healthy immune system, it could kill you, which is why when you look at the mortality data for old people, you find that old people aren't killed very much from the vaccine. If they're very old, like 90 years old, we find the mortality rates or the kill rates from the vaccine are relatively low because they have weak immune systems, and it's the vaccine itself your immune system's reaction to the vaccine itself that actually kills you. So this is why, because you think that, the vaccine, if there's a mortality signal, you're going to find it in very old people, and that's not true. And it's because they have weak immune systems. But when you start to get to people who are 60 and 70 years old, that's when you start seeing the rise in vaccine-related mortality. But I'm now off topic from
we've gone very far ahead. But I do want to get back to that. So then at a certain point, you're like, wow, my friends and family aren't believing me. So I think
my wife was getting questions from her friends like, "Is Steve okay?"
No.
No, totally. They thought
he's questioning vaccines.
Off that I was basically going crazy.
Unbelievable.
Yeah, that I was basically turned into a conspiracy theorist, that the government is suddenly evil and they're trying to kill us and all that stuff. No, the government is trying to save us. They're just being misled by the vaccine companies.
Right.
There's no conspiracy going on. The thing is that everybody wanted the vaccines to be helpful because everybody wanted to get back to work and everybody wanted to restore normalcy. And they were told that the only way this is going to happen is that if the vaccine is approved and so forth. So everybody has their blinders on this vaccine approval because it was the only way out.
Right.
It's like you go into the UK and it says, these signs saying way out. Yes, this is the only way out.
Right. So
everybody's
everybody's fully invested.
Everybody's fully invested. Everybody wants the vaccines to be successful. And so if you work at the FDA, you don't want to torpedo the vaccine because, they didn't do the animal studies and whatever. It was like, hey, unless people are dropping dead from this, you need to approve it. And they basically looked the other way when there were all of these irregularities in the trial. And these irregularities were very clear to anybody who analyzed the data, but very few people are going to actually look at that data with a critical eye, because first, why would you look at it from a critical eye? You want this to be true.
Right.
Yeah, right. And so you're not looking for ways to make it not true. But if now in my case, I'm looking for, wait a minute, how could this happen? And so you see these things like exclusions from the trial, people who were kicked out of the trial. There were more people were kicked out of the trial in the vaccinated group than in the unvaccinated group. Now, how is that possible, right? If these are double-blind, randomized trials, you can't have more exclusions in one group than the other group unless something is going on. And this data exists today. There are like 20, I've documented on my Substack, which I began after they banned me gave me a lifetime ban on Twitter for spreading misinformation. But I've documented there are like 24 irregularities in the Pfizer trial that nobody has answered.
And that article is still on your Substack.
Of
and
course.
so instead of just kind of going back to what you were doing at this point, your family and friends saying, oh, Steve's gone a little crazy. What's wrong with him? He's a conspiracy theorist. You doubled down. You started posting on X, and then you started a Substack, which has become, I call you a Substack sensation. And then you start diving even more deeply into this issue, and it becomes basically it becomes your new life's work, right?
Yep. I ended up quitting my job and just becoming a writer on Substack. And so I've written over 1,800 articles
That's
on
impressive.
vaccines.
And you have how many followers on Substack or subscribers?
It's over 250,000.
That's amazing. So Substack loves you.
Yes. People who read my stuff when I go to live events where I'm actually there, they come up to me and say, just love, can I take a picture with you? Can I take a selfie with you? Love your work. Thank you for doing what you're doing, and so forth. So never in my life have I gotten anything like that before.
That's great validation after what you've been through.
Yeah.
So, okay, so you start writing on Substack and you start digging deeper into the data. And what was one of the first discoveries you made at that point? And then did that lead to one of your first bets, all your famous bets?
I was concerned because I had heard of too many stories of people dying from the COVID vaccine. And that's the biggest thing, is the mortality. And it's objectively measured. You either died or you didn't die. Some of these other side effects are difficult to quantify, but death is relatively easy to quantify, and it's the most important safety signal. And we were told that these vaccines are safe, which means they should kill fewer than 1 per million people. And the numbers that we were seeing anecdotally seemed quite a bit higher than that. There are already 20,000 reports, or might have been 12,000 at the time, in VAERS. And VAERS tends to be underreported by a factor of 44, 41, or somewhere in the 40s.
Which you were able to calculate, right?
Yeah, because there were some studies that were done on anaphylaxis, and the result, so if you got the COVID shot, there's a certain number of people that would get anaphylaxis from the COVID shot. And so those numbers were well known. They were studied at Mass General. And the numbers showed that when you related those to the number of VAERS reports, which were required to be reported after those sorts of occurrences, it was 41 times lower than if they were all reported. So clearly, if you're not reporting anaphylaxis, death from vaccine is not going to be reported. Right. So at the same level, right? So it's probably death from a vaccine is probably 100 to 1 or more than 100 to 1. So when you see 18,000 deaths, multiply that by 100.
Yeah.
If you want to be conservative, it's probably more than that. Okay. Mm-hmm. So, 18,000 deaths by 100. Okay, so that's 1.8 million. That's a lot of people.
That's huge.
That died. Now, not all those VAERS reports are necessarily caused by the vaccine.
Right.
Right. Some of those could be just coincidence.
Right.
But people don't take the time to make a VAERS report on coincidence.
No.
It's got to be like he got the shot, he felt really bad, right, hours after the shot, and died 30 minutes after the shot, right? I mean, those tend to be the ones that get reported.
Right.
And so we're seeing these massive numbers. And it wasn't until I got the access, I was talking to a friend in the Czech Republic, and he pointed me to a FOIA request from this guy on getting record level data. And I started looking at that and I said, man, this is awesome. We actually have real data that we can look at, the record level data.
Well, explain for our audience, why is record level data so important to these analyses?
So record level data means that there's one record per person. So it says person X, and basically one line for the person says, they were born in this, their sex is this, they got their shots here, and they died here, right? So each record for each of the 11 million people in the Czech Republic.
So
and the Czech
really
Republic
powerful.
tends to tends to really take their data collection seriously, and they have centralized healthcare and so forth. So they're getting great data, and it's record level data, and it's publicly available. So publicly available record level data, that's a wet dream for a data analyst.
Absolutely.
And so I started analyzing the data, and what popped out was really interesting. The people who got the vaccine, their mortality rate went up every single month. Their mortality rate went up.
Wow.
Okay. But for the people who were unvaccinated, their mortality rate went down every single, it would be, it's like a trend going down. And I couldn't get my arms around that for the longest time. I said, there's something wrong here, because this is supposed to go up. People basically die. There's something called Gompertz mortality, and it says that people die in exponential, which means that if you were to, if somebody has a 1% chance of dying today, they're going to have a 1.085% chance of dying in a year from now, and then it's going to be 8.5% per year, and it just goes up exponentially. In other words, it's not plus 8.5, it's 1.085 times whatever your rate was. This is your risk of dying in a year.
So it's not linear. It goes up like that. It's like a parabola.
It goes up, like a parabola, but more. It goes up actually by an exponential. Mm-hmm. So if you graphed it on a log, if your y-axis is a log axis, then what happens is it becomes a straight line. And it's really interesting that people from age 20 to age 100 are along a straight line. So there's a biological thing. It's like, dogs have a much faster biological clock, right? Because the dog will die maybe at age 20 if you're lucky. Humans die at age 100. But that biological time clock in terms of your risk of mortality goes up in human beings by 8.5% per year. And it doesn't matter who you are, and it doesn't matter what your whether you've contracted cancer or what have you. If you contract cancer, maybe you get a step function here, but your chance of dying the next year is always going to be 8.5% higher. So these curves are going up for the people who get vaccinated, but they're going down for the people who are unvaccinated, which makes no sense.
0 sense, because vaccines save lives.
Of course, it should be. No, but
it should be the
point is that even if vaccines save lives, right, they're going to save lives from COVID lives, not going to reduce all-cause mortality. They're not going to extend your lifetime.
Right.
But the point is that
you're Dr. Sarah Meyer at the CDC.
What's supposed to happen is that the vaccinated would go up at 8.5% per year, but the unvaccinated would go up, but even more, because they're going to be exposed to a hazard that isn't covered by their baseline hazard at 8.5% per year. So I was surprised by this result, that the unvaccinated were going down. And this made no sense, because that makes the vaccine look really bad, right? Because if your control group is the unvaccinated, and they're right, but there are complications, because if you're unvaccinated, the people who choose to be unvaccinated tend to have higher mortality than the people who are vaccinated. So it's called the static healthy vaccine effect. And so this causes the people who choose to be unvaccinated to have like 3 to 5 times higher mortality rate than the people who are vaccinated. So people look at this and say, look, the unvaccinated are dying at three times more than the vaccinated. Well, duh, because it's all selection bias, because the people who tend to die more tend to be unvaccinated. And that's not because they're unvaccinated. It's because the people who are unvaccinated have who in general have lower socioeconomic status. They have less access to healthcare. They don't take care of themselves as much as people who are vaccinated. So this is not to say that if you're super smart, super healthy, and you choose to be unvaccinated, that you're going to die 3 times more. No, it's just you're in the cohort.
Well, and that's the fallacy of using all-cause mortality, because that's a blunt tool, right?
Right.
Yeah, you
right.
have to look at deaths from COVID or deaths after COVID shots in particular.
Yep.
And did the Czech data have that?
Well, the Czech data had record level data, so I was able to analyze it. So long story short is that divergence in these curves is caused by the heterogeneity of the groups. So there's something so we're getting way too deep here, but there's something called a gamma. There's a gamma distribution. So a gamma distribution is a probability distribution function. It looks like it looks kind of like a normal curve,
Like a bell curve?
But yeah, like a bell curve, but with very compressed. Typically, the variance is very small. So, in other words, most people are dying, along are just uniform. They're very uniform in terms of everybody's alike. The frailty distribution, the variance of frailty distribution is very small for people who are vaccinated, but it's much wider for people who are who choose to be unvaccinated. And because of that heterogeneity, because that variance is larger in the shape of the curve, that causes what's called depletion of susceptibles. The old people die very quickly off of that group because they're more frail. And so what happens is over time, it looks like, wow, the mortality of this group is actually going down in time rather than up in time. But it's a statistical mirage caused by this depletion effect. And so that's the reason for this. And so I developed this method to then counteract that so that I can numerically compare these two curves that were going like this. So basically, I make the curves look the same, and I take out the variance of the gamma distribution. And once I do that, then the curves basically sit on top of each other. Now I can compare the two cohorts fairly. And the way I describe this in a way that people can understand is, suppose I have go-karts, right? And everybody knows go-karts, right? Mm-hmm. And they're all on a hill. So I have two go-karts. One go-kart is on a hill that goes like this, and another go-kart is on a hill that goes like this. Mm-hmm. And I'm timing them at the finish line. Well, they're going to finish at different rates because the slopes are different, not because the go-kart is better.
Right.
So what all I'm doing is I'm saying, okay, I can then recalculate based on gravity what the slope effect on the go-kart would be, and then calculate the normalized score so we can fairly compare the go-karts.
You're normalizing the data.
We're normalizing
it
because they were on different, in this case, different inclines. Mm-hmm. I can neutralize the inclines. And I'm doing the same thing for what's called the hazard function over time. I'm just basically neutralizing the incline for the two groups, and the incline is caused by the heterogeneity that happens to exist with unvaccinated. And so once you do that, mm-hmm. then the data is very clear.
And it's very easy to interpret at this point.
Very easy. Okay. It's crystal clear.
And so what's the bottom line?
The bottom line is that vaccines kill people.
At what rate?
They killed. You have to be very careful with this, right? Because the method gets you closer to the truth than the methods that they use now, like Cox proportional hazards, which is totally inappropriate for this data set. And so this method that I invented gets you much closer to the truth because it normalizes things based on hey, let's look at the data, let's look at the empirical data. We can then estimate what these curves look like. And so, it looks like it's a 20% type of increase in mortality if you got the shots.
20%.
Yeah,
so
that you're to increase your mortality. But you see...
Oh, no, that's not overall mortality rate. So it's a 20% increase in the baseline risk that you're going to die, right?
Correct.
Because not 1 in 5 people are going to die after COVID shots.
Correct.
Okay. So we have to be really clear about
that. Whatever your baseline was, it's like you're going to die more. It's going to make you more likely to die than less likely to die.
That makes sense.
If you got the shot. And it's a temporary effect, and it lasts, and that elevation mostly lasts for the first 6 months after you get the shot. So you have an elevated risk in the first 6 months. And then it's hard to tell what happens after that because it's not a
too many
controlled study.
confounders.
That's why we need randomized trials. But, you're looking at observational data. It's always confounded. So you have to, that confounding has limitations in terms of what you can identify. It's called identifiability from that. But we can clearly see that if you got the shots, you were worse off.
Yeah.
And then you have to look at the aggregate data and you say, well, gee, was there a increase in death in the population? And that's hard to tell because there's all sorts of confounding things. Because once you have this depletion, this mass depletion caused by COVID, then you should have a trough in terms of the people available to die, and so you should have lower amounts. So the fact that the mortality sort of went back to normal, it should have actually gone lower than normal. So did it actually increase? So all of these things are kind of hard to tease out.
Should be a culling and then a lower level of deaths, and then it should start to go up again. But you didn't see that.
We didn't see that. And
okay. Let me summarize what you just said. So let's say somebody has on average like a 1% risk of dying in any particular year. If they got a COVID shot, their risk of dying that year would be 1.2%, right?
Yeah, it'd be like 20% higher than what it would have been normally. But the other thing you have to realize that's important is that, and people can say, "Whoa, no," but most people got vaccinated, and there wasn't a 20% increase in mortality. Well, that's because the people who get vaccinated have 3 times lower mortality than people who die. So you have to then do the adjustment. You divide by the 20%, divide that by 3. So now it's a 7% increase. So now it becomes sort of in the noise. And so the point is that, yes, you can get a 20% increase in the vaccinated, but the vaccinated are dying at, say, 1/10 the rate of the unvaccinated. So even if you increase those numbers, your total numbers are going to be relatively small and not so easy to measure. And so this is why when you look at things on a population basis, you'll see that, mortality didn't quite go back to normal. And depending on what country you're in, you're going to see, you can see sustained higher levels of mortality. And in fact, if you look at the U.S. data, you actually find that you can go to Mortality Watch, and they have great graphing tools where you can look at the mortality over time and see that it doesn't go back to normal.
Is that the MMWR at the CDC?
No,
that's different.
No, this is more sorry, yes. Mortality. I think it's more. It's called Mortality Watch, but I think it's mortality.watch, or they have some clever URL for it.
All right, so let's sum up the Czech data. We've summed that up, right? That's where you found the 20% increased risk of dying if you got the COVID shots. And so you put that on your Substack, and did you write the Czech government and let them know? What'd you do?
They don't care.
They don't care. Like everybody, they don't care.
Nobody cares. Not government and care. That's like an oxymoron. Right. So nobody has reached out to me on this method. I wrote the method in a paper. It's 50 pages long right now. It's available on my website. I haven't submitted it to a journal yet. The reason is I'm still to submit something to a journal, you don't want to get rejected, and so you have to go through like all of the possible objections and make sure that you've nailed everything. So I'm still going through Grok's. I put the paper into Grok, and Grok said, well, there are 4 fundamental things that you have to correct, and then here are 4 nice to have. So I've addressed all the 4 fundamentals. I've now on the nice to have, and once I finish those, and then I'll submit it to a journal. But I wanted to make sure that I could pass all of the tests when I gave it to
for peer review.
AI engines are good proofreaders to say whether your paper is ready to be submitted or not.
Is this your first biological science paper that you'll have published?
Yes.
That's amazing. Congratulations.
Yeah.
I'm sure it will get published.
Yeah. Well, we'll see.
Yeah.
We
don't know.
But I crafted the paper in such a way that I avoid the question of vaccines. I just say, hey, here's the Czech data, and look, if you do this 6 months after people get shot, then the curves are normalized for the vaccinated and the unvaccinated, showing that there's no difference, which is what you'd expect because there's no more. The COVID is mostly gone. People have already either contracted COVID naturally or they've been vaccinated, so they're all basically immune to COVID and they're pretty much the same. And the data shows, in fact, that if you look at 6 months into 2022 in the Czech data, that they're flat curves. But if you do something like a Cox proportional hazards model on this, all bets are off here because it's just so confounded by this data. And so I show that in the paper. I say, gee, anybody relying on Cox, they're not getting valid data. And the beauty is that there are at least 3 papers that have been published that I refer to in my paper that validate that, in fact, they said, hey, we actually really need randomized trials because we can't tease this out from the data, because even when we do Cox proportional hazards analysis on the data using very matched groups that are matched, like these people got diabetes on the same day, that sort of thing. I mean, it's not quite that bad, but they're matching people like every person vaccinated versus unvaccinated are matching one-to-one people with every comorbidity and all that. And they still were getting these huge differences. And they said, this stuff is so confounded, we can't tell the difference and we need randomized trials. So there are actually 3 papers in the literature that basically admit that, hey, the data is too confounded for us to tell you whether the vaccines killed people or not. So we actually don't know.
That's a really bad sign because everybody thinks that the COVID vaccine saved us, and it's not obvious in any data set that that's the case.
Right. And this is why these people who are among the best looking at data said, well, wait a second here. We can't normalize this stuff out with our normal methods. We don't have a method to do this. So we need randomized trials. And the answer is you don't need randomized trials. You can use this method that I created that nobody wants to look at to find the truth.
Well, hopefully once your paper's published, they will look at it and take you more seriously. So speaking of taking you seriously, what led you to your first bet? And what was the bet about?
Well, so my first bet was, I had a number of things. I said, look, my research shows that vaccines cause autism, that and I had a long list of things. I said, I'll bet anybody $1 million on any of these. And so this guy, Sar Wilf, says, okay, I'll take you up on the vaccines have killed more people than they saved. Because I said, they killed more people than they saved. And he says, no, it can't be right. Because everybody says that they've saved tens of millions of lives, right? So you have, on the one hand, Denis Rancourt saying, hey, they've killed 10 million people. And on the other side, they're saying, oh, they've saved 10 million people. Right. Now, somebody's fibbing.
Right.
Somebody's not telling you the truth. And Johnny Anides recently published a paper based on modeling data showing that, it's not 10 million people, but maybe it's like a couple million people whose lives were saved by the COVID vaccines. But it's based on modeling data.
Right.
Right. And that's horrible. You can't.
Right. That's not admissible in court.
So he's basically, he wrote a paper earlier saying that over half the research stuff that's published in journals is wrong. So he's actually contributing to the half that's wrong with that paper was right and his other paper is wrong. He wrote a paper recently saying that, okay, well, if we look at the data from these studies and we put that into our models, then the models show that the vaccines save lives because, of course, vaccines reduce your mortality from COVID. And so how could it not save lives, right? Because where are the studies that show that vaccines kill, 1 person per 1,000 or, increase your mortality rate? Those studies don't exist. They don't get published. There's a data scientist in Canada who's being pursued by the authorities because what he did, he's a data visualization specialist working for the government. And so he teaches data visualization to people in the Canadian government. This is their go-to guy for data visualization. And he was saying that, wait a minute, these data visualizations that you're giving to the public on the COVID vaccine are actually misleading. The data is showing you the opposite. The data is showing that the more vaccines you get, the higher your mortality. And so he's got these great visualizations. They're like these needle curves, like when you pump air into your tires and the needle goes up for how many pounds you have?
Yeah.
Well, so he made these needles, and he showed the needle what it is for the death rate for people who are unvaccinated, and then for one vaccine, and then two vaccines, and three vaccines. And so the needle is here for one or for no vaccines, and then it goes higher for one vaccine and higher for two vaccines and goes higher for three vaccines. So it's really easy to see what's going on. And he says, these are the data visualization tools that you should be giving to the public to show them what's going on, because your statistics are very misleading. And so he was told to basically shut up.
Wow. It sounds very clear.
Because he has a loyalty to the government, not to the people.
But the people are the people paying for him to do that work.
Exactly, and
they report to us.
That's why he went out, because he says, well, look, there's a scientific integrity standard in Canada, and that takes precedent over my duty to the government, because the duty to the government, in fact, is if it's the science says this, my duty to the government is to be true to the science. And so he has this hearing in a couple of days to determine his fate as to what happens to him.
Wow. Why does he have a hearing for he's a whistleblower? He's reporting the truth?
Because
why would there be a hearing?
Because his supervisors were ordered to tell him to cease and desist from saying anything that goes against what the government is saying.
Unbelievable.
No, not at all unbelievable in Canada.
I know. Truth tellers are...
Right. Yeah. I mean, if you're... the other people in Canada have faced far worse than this guy has faced.
Yeah, Canada was not kind to people during COVID.
No,
citizens,
it's
truckers,
like if you
scientists.
go and we don't even want to talk to you if you have evidence like they try to have a debate between the people that disagreed with the health officials, and nobody showed up.
In Canada.
Nobody showed up from the other side. Nobody showed up on the official side.
And you weren't part of that debate?
No. Okay. No, so they can't say it was me.
Right. It wasn't Steve Kirsch.
No.
Okay. We know so many of our listeners understand the relationship between health freedom and our personal and economic freedoms. It's the same principle. If you're one of our audience who's concerned about inflation, paper asset crises, and ongoing monetary crises, you may have already started accumulating gold and silver or are considering doing so. There's no gold dealer we know who's better positioned to serve the freedom community than Mish International in Menlo Park, California. I'm one of the many happy customers who's purchased gold or silver in their showroom, or I've had it delivered through their secure courier service. They are true veterans who are honest, fair, and reliable, and so knowledgeable regarding all the choices of gold and silver bars and coins to help you choose the products that fit your goals and your worldview. The principal, Robert Mish, is world-renowned for his expertise in rare coins as well. Write down this number, 650-324-9110. That's 650-324-9110. And visit mishinternational.com. That's MISH international.com to learn more about this notable company. Tell us a little bit more about your latest debate. You did, I think your last one was in New York?
Oh, yeah.
That wasn't what we thought it was going to be, though, right?
No, because, it was like, gosh, we can't get anyone to debate. So finally, we get this call from this guy in New York saying, okay, I got these two guys that want to debate you. And so great. I'm like, and it just turned into to ad hominem attacks. It was like, we should be talking about the science. We shouldn't be talking, like, he asked me, so are you selling supplements? I'm like, what is selling supplement? First of all, no, I'm not selling supplements. What does this have to do with a scientific debate? These are character attacks.
Right. Yeah, it's the lowest form of argument is an ad hominem.
They have no, let's talk about the science. Let's talk about my methodology for neutralizing these cohorts.
They weren't prepared for that at all.
No.
Wow.
And they had no contrary analysis. Like, let me see their analysis.
Wow. So what are you doing now? What's your favorite project you're working on at the moment? You're writing that paper.
Yeah, completing the paper. That's my first priority.
Okay, and you did have an open letter to the AAP.
Yeah.
Tell us about that.
So the AAP, of course, has sued Kennedy, and then there's another suit on them for misleading the public, and the suit on them says, hey, look, there are no studies that show that if you get vaccinated, you're going to have lower mortality, that it saves lives. So there's nothing that shows that vaccines save lives. The CDC actually did a study to show that, but the study showed that it didn't save lives.
Oops.
It got published, but nobody knows about it.
Huh.
Like, you probably don't even know about it.
I don't know about it. Where was it published?
It was published, I don't even remember. I don't think it was MMWR, but a 2017 study on whether they looked at kids who got the full schedule versus kids that didn't get the full schedule. They got substantially fewer vaccines. There was no mortality difference between the cohorts. And, well, I know of a clinic that basically doesn't vaccinate their patients and hasn't for 25 years. And the kids don't die from the vaccine preventable diseases.
Right. The unvaccinated ones don't die.
They're way healthier
right.
than the kids who got the full vaccination schedule,
right.
which is why the clinic recommends against the vaccines.
So two flaws with that study that I know already. They had a too short of an observation window, right? And the unvaccinated group wasn't completely unvaccinated.
Yeah, correct. But the point is that they couldn't show a benefit.
Right.
So there's no study that has ever been done showing that if you got the full vaccine schedule, that you have an all-cause mortality benefit over people who basically avoided vaccination.
So who is the onus on to do that? Is that the CDC?
Yeah.
Okay. So what did
you
your
would
letter?
Think if the vaccines worked, these guys would have done that study like 20 or 30 or 40 years ago.
Right.
Right.
I mean, it's a little bit of a red flag.
Yeah. If it works, where's your study?
Right.
Like, you're telling people it saves lives. So in California, you're required to get the full childhood schedule.
Right.
Why?
Right.
What science is that based on? They've showed that it makes no difference in terms of mortality.
Right. It's based on the mantra safe and effective.
But these things, like the number of people who die from measles in a year, I mean, you have to have a randomized clinical trial on millions of kids lasting for over a year to show that the safety level of the measles vaccine is sufficiently low compared to the number of lives that it would save. And so, because it's got to be a lot safer than the cure has to be safer than the disease.
Exactly.
Right.
But if you go in, like I did this presentation with you about measles, if you go into VAERS, there's 123 deaths from the measles shot in VAERS.
Yeah.
And it's underreported.
Yeah.
So, I mean, we're looking at thousands of deaths after the measles shot and not nearly as many deaths from measles in the same period.
Yeah. Well, the point is that for California to say you have to have these shots to go to school, it's unethical. They don't have the safety data on any of these shots to establish that the safety level is below the risk of dying from the vaccine preventable disease, not for any single disease.
Yeah, would you say
it's completely unethical?
It is. Would you say it's like asking every parent to play Russian roulette with their own child?
Yeah, because we believe that we think that that will save lives.
Right.
It's not based on science.
No, you can't do it on beliefs, though.
Yeah. And even if it was based on science, it should be, we recommend. And you make the decision because vaccines kill people. We have so many cases of kids dying after getting their vaccine shots. So you can't mandate something and say, you're going to make this life or death decision based on your, we're going to make that life and death decision for you. It's unethical. They don't have the data. And even if they did have the data, it's still unethical. But the point is that they don't have the data. They're making these recommendations based on the perception that vaccines save millions of lives And it's a no-brainer, and you have to be a conspiracy theorist not to believe the science that the vaccines save lives. But the point is that there is no science, and so I wrote this open letter to AAP saying, I went on your website. Your website doesn't cite anything other than modeling studies. You need more than modeling studies. Modeling studies don't cut it. When we're talking about the safety of a vaccine, which is given to millions of people, modeling studies are insufficient to do that. That is insane. Why don't you do the million-child randomized trial for a year and prove the safety? Well, of course, they're not going to do that because it would show that the vaccines are unsafe.
Right. And you didn't hear anything back from the AAP?
No, of course not.
Just like every other public
Just
official
like
you've contacted?
every other public official I contact. I cannot get a debate with any of these people to, for anything. I mean, I've offered Paul Offit $1 million to have a debate with me, and he refused. He says, science is not something we debate. Science is something that we do in the literature. And I said, really? Oh, well, then I guess vaccines and autism is settled science by now because it's in the scientific literature, and there are 1,000 papers that show it's related, and there are 1,000 papers that show it's unrelated. So where's the resolution? It's got to be one or the other. It either does or it doesn't.
Right.
So, but we can't talk about it because Paul Offit says that it has to be decided in the literature. Okay, yeah. So great, Paul. So we've had 30 years or more of literature. How has it been decided? Well, his opinion is that it's decided that it doesn't cause, and my opinion is that no. In fact, you never did the right studies. You never did the studies showing the onset of autism as a time offset from the time of vaccination.
That's right.
That's the one study they will never, ever do.
No, because in VAERS, it shows that 50% of autism cases occur within days of vaccination.
Yeah, so they're not going to do that study. So Paul Offit says it's not, and it's never going to be published. If they ever did that study, it will never be published. It's like the study they did at the Henry Ford Health System, where they looked at vaxxed and unvaxxed. Mm-hmm. And it was clearly the unvaccinated were clearly healthier than the vaccinated. Yep. And Zervos, who did the study, Marcus Zervos, basically said, and he said it on camera, he says, if I publish this would destroy my career. I'm retiring, and it will destroy my career anyway. And even though I'm retiring, I'm not going to do it because it would destroy my career.
It's unbelievable. I mean, I don't think we've ever seen that in history of somebody actually admitting that the result didn't support their beliefs. Right. So they're quitting.
Yeah. But it was on hidden camera. Otherwise, he wouldn't have said it.
Exactly. They have a lot to account for. It seems like that study should be redone, and NIH should pay somebody at Stanford or somewhere else to redo that study with their raw data. Yeah, replicate it or just get the raw data.
Do it right this time, because obviously their top infectious disease person at Henry Ford Health System is incompetent, because that was the institution's. The institution basically said, look, we're one of the top health organizations in the country, but our head of infectious disease is incompetent. That's basically what they said. Right. He's incompetent to do any scientific studies.
They're throwing themselves under the bus rather than have a study in favor of unvaccinated children's health.
Correct, because that would destroy them. They would be destroyed forever.
Wow. So they're just going to have their people land on hand grenades.
Right. So it's better to sacrifice their scientists.
Right.
And sacrifice the institutional reputation, because protecting the institution's reputation is by far more important than saving lives or saving kids from autism or saving kids from mortality. I mean, like, if Henry Ford's reputation was exposed as, oh my gosh, they did the study showing that the unvaccinated are healthier. Well, it's going to happen sooner or later, folks. So they're basically saying, well, let's double down. I don't think this is ever going to come out that the unvaccinated kids are healthier. So let's double down, because that way we maintain our reputation while I'm still the CEO. And when I'm not the CEO, then who cares? Let the other guy, I'm retired by then. Right. So, I mean, I sent a text message to the to the CEO, Bob Riney of Henry Ford Health System. And I got into a nice conversation with him, and we're going back and forth. And then I said, "Have you seen the movie?"
An inconvenient study, right?
Yeah. Have you seen the movie? Nothing.
Really?
End of conversation.
Really? So
We're
he's
done.
seen it.
We're done. I don't know. He didn't answer the question. It was an innocent, it's a yes or no question. He wouldn't answer the question. Have you seen the movie? How is that like, you can't answer that yes or no?
That's ridiculous. Well, because he can't have the public know that he's actually seen the film and knows that the study is valid.
We don't know. We don't know if he's seen the film, right?
That's incredible.
He's like, our conversation is done.
I love how you get this information out of people. And they just hit a brick wall and they stop talking to you or they don't answer. And then we have our answer.
Yeah, it's like, can't. People are basically, they disengage when, if they're threatened, it's like, don't want to talk to this guy. Right. Nobody wants to talk to you.
And basically, like, you've read Thomas Kuhn, The Structure of Scientific Revolutions, right?
No.
Oh, you haven't?
No.
Oh, it talks about a dominant paradigm and how there's always an emerging paradigm in science. And it's only through the accumulation of anomalies that the emerging paradigm takes over and becomes the dominant paradigm. And that's where we are right now. We're just in a pendulum shift, and it's very contentious right now because that emerging paradigm is coming in. And sadly, the book concludes that the way that it shifts from the emerging paradigm becoming the dominant one is for the people to die. And new people have to come in without the preconceived notions.
But of course, we condition all of our children in school. Vaccines are good. You had to get vaccines to be even in school.
Right.
I mean, so it's like.
I don't envy the position they're in.
It's self-perpetuating.
They know that they're responsible for all these disabilities, all these deaths, and it's really hard to admit it on a personal basis. I mean, iatrogenesis throughout history was a big problem in so many situations, and here it is again today. We think we're better than that today, but we're not.
No.
Not at all.
The first rule of holes is when you find yourself in one, stop digging.
Yeah.
And this is, people apparently still haven't learned that lesson.
No, they really haven't. So, Steve Kirsch, what can people do? What are the most important 3 things people can do right now to help change this situation? Can they support your work at VSRF? Can they take action with the government? What do you think they should do?
Well, if I had 3 wishes, if you were a genie and you could grant my 3 wishes, my 3 wishes would be that Robert F. Kennedy Jr. is the head of HHS from now for the rest of time. That would be like, that would totally be game changing because it's all about leadership. It's all about honest leadership. And RFK Jr. is as honest leadership as they come. I mean,
I couldn't agree more.
Can't do better than that. And so he can change lots of things in his position and expose the truth. And that's what he's about. So you need people in a position of authority to not be afraid to tell the truth. And we just have too few people in that position that are doing that. And so that's one thing. So I would like more people in a position of authority to say, hey, let's look at what the data says and let's expose the data and let's make this about data transparency and maintaining the privacy of the dead is probably less important than using their data to protect the living. And maybe if we prioritized living people's life and death over dead people's privacy, right? Because right now we're basically saying, hey, you die, you have a right to be private about what your cause of death was and what your vaccination status is and all that. And we're going to keep all that private because we know how hurtful it would be to you as a dead person to have your information released that would reveal who killed you.
It's absurd.
It's absurd. But that's what we do today. We have all these laws that protect the health data of the dead.
That's insane. Truly. It's public data. That's from the Bureau of Vital Statistics. It's public data.
It should be made publicly available.
Yeah.
The stats that I rely on is I look at the people who have died. Why should their data be, we can't tell you that because you violate privacy. So anyway, getting that data out, getting like what the Czech Republic did with the record level data, that could be done anywhere.
Yeah.
They don't reveal your birth date. They just say you were born in a 5-year interval. Mm-hmm. When you die, you died in a week-long interval. And when you got your shot, it was in a week-long period that you got your shot. Mm-hmm. It's 11 million people. Okay, anybody bigger than 11 million people, we know for sure that your privacy is not going to be violated because nobody's complained in the Czech Republic when they revealed that record level data. So why don't we just expose the data in the United States?
We could. It's easy enough to de-identify it.
It should be.
And we have it. We have it in Medicare and Medicaid.
The UK could, of course. And the UK said, oh, no. Privacy reasons. We don't want to. No, come on.
Ridiculous.
Come on. We need to save lives. Saving lives should be the priority. So,
you know what we need, Steve?
Maybe honest health official. Right?
Okay.
That's an oxymoron.
Yes,
honest
exactly.
health official, like Postal Service.
You know what we need? Like when you you sign something and saying you'd be an organ donor upon your death, you want to give your body to science upon your death. Maybe people need to sign something that says, I want my data used after I die.
Right. Yeah.
Give consent before.
Right. Yeah. How many people would consent to that?
Everyone.
You know, I should do a poll on that to see how many people would consent to that.
Do it.
Right. Because there should be a law that says once you're gone, your data is public.
Yes.
Like, you know, unless you sign something saying I want to withhold my data.
Right.
Right. Which gives people the ability to do that. Right.
The default is it's public unless you sign something saying no.
And who could object to that?
No one. They're going to be dead.
Right. Right. You change the world if you did that.
Okay. And your third thing.
Okay. So number one was RFK.
Yes.
So number two is let's get rid of all the vaccine protections for the liability protections for the vaccine makers. So the PrEP Act and also the Childhood Vaccine Act of 1986. Let's get rid of those so that there's no protection. There's no liability protection because we all know, Alex, that the vaccines are the safest interventions on earth. There are no drugs that are safer than vaccines. So it's baffling to me that the only drugs, in fact, the only products that get full liability protection are the vaccines.
It's baffling.
I can't figure it out. They're the safest products on the market, and they're the only ones that require liability protection. I still haven't been able to figure that one out.
It's really a tough one to figure out right there. I don't get it.
Yeah. So those would be my top two if I had a wish. If people want to follow me, they can follow me on Substack, Substack.com. I'm on Twitter. I think it's St. Kirsch on Twitter because S. Kirsch was taken. And stay informed.
Yeah. What about VSRF.com or .org?
So it's vacsafety.org. So it's a little bit more complicated.
Vacsafety.org. And you have a gregreat show on Thursdays, right?
Yeah. Uh-huh.
Tell us a little bit about that.
Well, so I announced it on Twitter, and people get emails if they've attended previous shows. So once a week we have special guests on. So you have Robert Malone was a guest. The former CDC director was a guest on our show. So things like that. So we talk to interesting people about interesting topics. So far, we haven't gotten anyone to appear on our show, though, who is pro-vaccine, surprisingly. So we can ask questions.
I wonder why.
It's a perfect opportunity for them to convince all of these people who are conspiracy theorists that they're wrong.
That's right.
Well,
that's right. Somebody should take you up on that offer who's pro-vaccine.
Totally.
I'll see if I can find someone.
Yeah. Good luck. Good luck with that one.
I'll be looking the rest of my life probably.
Good luck with that one.
Well, Steve Kirsch, what a pleasure. I've always enjoyed you. I've really had great admiration for all your work that you've done, that you've been a leader with the COVID data in this COVID era, as I call it. Thank you so much for coming here. We really appreciate you being here.
Yeah, my pleasure. Thank you.
We are so happy to have as our prime sponsor, Mish International, Northern California's acclaimed specialists in rare coins and gold and silver investments. Our friend and supporter, Robert Mish, is the same principal that started the company back in 1963, and he's still there every day with 63 years of experience. He has integrity, reliability, and fair pricing, whether you're buying or selling. When you have business to do with precious metals, you'll always be treated well at Mish International. Call 650-324-9110 and tell Robert that Alex sent you.